First of all, thank you. Today's webinar is Postural Orthostatic Tachycardia Syndrome, warmly known as POTS. And we're going to, this is presented by CHYP, Creative Healing for Youth in Pain, which is a nonprofit that's all online, and it helps families to understand chronic pain so that they can get effective treatment. CHYP connects families, kids with others dealing with pain and associated symptoms like POTS, among others, to remove feelings of isolation. CHYP provides creative healing experiences that, as I call it, unstick sticky neural loops and provides a pathway to healing. So today I'm really excited to introduce Dr. William Zempsky, who's a friend, a colleague, and really a national, international pain expert who will be discussing POTS. And POTS is a very common complex of symptoms experienced by many patients who have chronic pain. And it can occur when the autonomic nervous system becomes dysregulated or out of balance. And Bill is internationally known in the pain field. He's director of the University of Connecticut Pediatric Pain Program, and he's also holds the endowed chair for pain and palliative medicine in the Department of Pediatrics, University of Connecticut School of Medicine. And we're grateful to Bill, who also gives his time and expertise as a member of CHYP's Clinical Advisory Board. I'm also very excited to introduce our webinar series moderator, CHYP's board member, Dana Pachulski. Dana holds many distinguished hats. She's a member of the board of directors for the UCLA Resnick Neuropsychiatric Institute. She's co-chair of the Cedars-Sinai Hospital's Regenerative Medicine campaign. She's also, I'll take a breath, member of the board of directors for Children's Museum. So we have a great discussion planned, and we have time for live Q&A at the end. And we'd like to ask everybody, please mute yourselves and keep your cameras off so that we can focus on Dr. Zempsky and Dana without distractions. Also, type your questions into the Zoom chat throughout the webinar so our speakers can address them. And before I turn the webinar over to Dana to get our discussion started, I want to remind everybody to go to our CHYP website and learn about the next webinar, which will be on depression and adolescence, and also the many other programs that CHYP offers. So take it away, Dana.
Thank you, Dr. Zeltzer. Thank you, Dr. Zempsky, for joining us. And thank you, everybody, for taking time to join us on this Zoom. I hope that we'll be able to answer some of your questions and give some information and help wherever we can. So Dr. Zempsky, I think it's best maybe if we start with talking a little bit about the autonomic nervous system, right? I mean, let's describe how we get to the place of POTS and what we can do along the way, and then
sure. So, you know, we think of POTS as a disorder of autonomic dysregulation, or what I like to say to families, that the autonomic nervous system is a little out of whack. And I think, you know, what we know is that, you know, the autonomic nervous system, if I talk about things that you don't think, the autonomic nervous system regulates things that you don't think about. So whether that's your heart beating, your eyes blinking, but also the caliber of your blood vessels, how blood flows through your body, and a whole host of other things. So the autonomic nervous system is really an essential driver of your physiology, if you will. And, you know, I also talk to parents about how really the pain system itself is part of that autonomic nervous system. You don't think about how pain and or other messages are transmitted through your body. And so the pain system is part of that autonomic nervous system. And, while we don't understand, or I don't understand necessarily how POTS get started and why it seems to afflict kids with chronic pain disorders necessarily, or things like Ehlers-Danlos syndrome, which folks may be, why it seems to be more prevalent in those populations. We do know that there's some connections there between the pain system and the autonomic nervous system. So is that helpful?
Yeah, I think it's very helpful. And I think if we can just spend a few more minutes talking about this, my understanding, and please help me help everybody else understand, that the autonomic nervous system is like a teeter-totter, the parasympathetic and the sympathetic, and it's supposed to teeter and totter.
Yep.
And that with some stimulation, whether it was a car accident, a near car accident, somebody made you feel bad, bullied you at school, something that triggered your body to go into this fight or flight, right? That the teeter-totter isn't going back and forth between the parasympathetic and sympathetic nervous system as naturally as it should, and that it eventually gets stuck.
Yeah, I
think,
certainly though the autonomic nervous system, as Dana says, is kind of like a teeter-totter. We use the word in medicine, homeostasis. So coming into some type of balance. And certainly for whatever reason, and Dana mentioned a couple, when we talk about POTS or other autonomic disorders, if you read the literature, they seem to start after an episode of either physiologic or maybe emotional stress. So that could be an infection. That could be a trauma. Pregnancy actually has been implicated as well as something that can lead to POTS. So the question is, something, again, dysregulates you, takes you out of balance, and then, for lack of a better term, I think, Dana, it's a good one, you're kind of stuck. And one of the things that we think about, and folks will argue, certainly in chronic pain, people use the term, and I've used the term, primary and secondary POTS. So what leads you there? And in chronic pain, people, it's that lack of activity. Once you are deconditioned, it may be the deconditioning itself that leads to some of the changes or imbalance of your autonomic nervous system, which can lead to some of these symptoms.
And so how can we as parents see some of the warning signs that maybe the system is getting dysregulated and the potential for getting stuck or, going into a diagnosis of POTS is coming?
And it really depends. Again, it gets to that chronic pain versus not. And I see some kids who end up having POTS from both situations. So if we're talking about kids with chronic pain, oftentimes those symptoms overlap, so it's hard. And I really see, so kids with chronic pain will obviously present with pain, but they'll often present with other symptoms like fatigue, fogginess, sometimes temperature instability, although that's kind of a classic autonomic symptom. Dizziness is something that not all kids with chronic pain have, but kids with POTS certainly do. And it's that change it's that dizziness that occurs from when you're going from what we call orthostatic change, from laying down to standing up. So POTS in itself is postural orthostatic tachycardia syndrome. It's a description. It's not it's a syndrome. It's not a disease per se, but it's a description of what happens, right? You change position and you get tachycardic. So it's, that itself, would be the warning sign that would be most identifiable to parents outside of what they would see from their child's other chronic pain syndromes. But it's really hard in that setting to tease out what's what and how much the symptoms are being caused from their underlying pain syndrome or their POTS, or really I consider all these syndromes kind of locked together. There are those kids who present, rapidly. They get and I've seen some of these, they get a viral infection and then they're exhausted and they're dizzy and they're cold and they're hot. That's a little, those symptoms, lead you to think about POTS as a primary problem. Now, many times those kids will develop pain along the way and other symptoms. So again, it's that overlap, and the more we know about these chronic symptoms, and there may be some link, in the etiology of these problems. I'm sure everybody has read about long COVID as a syndrome, and we're seeing some of these kids with long COVID, and they can have dramatic autonomic abnormalities, but also pain. So, one of the good news, frankly, if there's any good news about long COVID, is it's shedding a light on some of these syndromes that weren't getting a lot of attention or even belief. I mean, just like folks with chronic pain, I think folks with POTS suffer from a lot of stigma and disbelief about their symptoms. So, there's certainly crossover, but I think for parents looking for those, those signs of temperature instability, dizziness, are things that will at least cue them into saying, hey, could somebody look at my child, who already has chronic pain? Maybe they have POTS too.
Well, and I think that for parents to look at that as the warning signs, right? If you're seeing these things, you're knowing that the body isn't regulating, and knowing that then they have to do something to help those systems kind of stay safe so that they're not getting even more stimulation, which pushes them over the edge.
Right.
And what can we do? What would we recommend for those parents to help those kids if they're starting to see some of those signs, and their children are still able to go to school and function, but they're starting to see some recurring symptoms like this, and the pain's creeping in? We're starting to see the stomach ache or the headache. We see the anxiety.
I think the easiest thing, and it may not always be easy, but the most important thing is to keep moving. Right. Somebody a few years ago, and this goes for chronic pain too, if there was one word you would tell patients with chronic pain, and I'll add POTS to that, what to do, it would be move, would be that one word. And because, it is clear that movement exercise is to me, the safest, least expensive method of treating these type of disorders. And not that they exist alone in that treatment, but they are incredibly effective. It's just every day it's moving a little more than the day you moved before. So it's not, I never say, well, I'm going to go make you run the mile. I'm going to make you, walk to the mailbox. I'm going to make you get on a recumbent bike and ride for 2 minutes, then 3 minutes, then 4 minutes. And, it's very gradual. If a child's going to school, obviously they're ahead of that. So we just need to push that envelope just a little bit. It's often helpful to do that with a physical therapist or with a knowledgeable trainer who's not going to push you too hard to get started, to really know how to program that and do that. But it's just doing a little more, moving a little more every day.
Well, that's exactly what CHYP does, right? We're here to help people retrain their brain, right? They've gotten so dysregulated and they won't get out of bed or they won't do anything because they've got fear of their pain. So what you're saying is the same thing. Just move. And if they're afraid to move, then you do 2 steps. Then you do 2 steps for a couple of days, and you do 3 steps, right? Break it down in small pieces. One
of the things I often tell the kids who come to my clinic, when they tell me that, they say they're challenged to do something, or I say, well, you made it to my clinic, you drove here, you've been here for 2 hours, sitting in a chair upright, and you're probably going to drive home. And so if you can do that, that's, then see how you can, what else you can do. See if you can move a little more forward.
So it's really just encouraging them to keep doing something.
And also to recognize that they're doing things, they're just not, they just don't see it. when you're in the middle of it, you can't see how effective some of these things are or how you're making progress. That's where, a psychological support is really effective too, because it challenges those notions about what the barriers are. I can't, and helping kids and families problem solve around, okay, how do you do this? How can you just do a little bit more? Where can we put this into your day? How can you do this even though you have pain, et cetera, et cetera. So it's working through some of those barriers that become really important.
And probably the hardest thing is like telling a child, look, you drove here. No, I didn't. I didn't drive here. They'll just tell you that side of it. But I think a hard part for parents is that their children will say, I'm dizzy. I can't stand up. Look, I'm nervous. I'm going to faint. And what would you do to help the parents ease
Matt?
Oh.
Hello?
some there
All
you
right.
go. I got
Sorry
muted.
about that.
That's okay. So, really, I think what I'd love to spend a minute on is the parents whose kids are dizzy. They've already experienced these symptoms, but they have no idea why. I
Right.
think sometimes once you get the diagnosis, that's a different level of feeling settled, even though you're still unstable with the POTS, but you have a diagnosis. But for so many people, they don't have a diagnosis yet. They don't know why they're feeling dizzy. They don't know why they're having a drop attack or, why they're just passing out suddenly. What can we do to help parents?
Yeah, I think, at some level, diagnosis is important because there are other reasons why kids can have these episodes, and I wouldn't want to miss something that we need to discover from a medical standpoint. So I would always, if your child's having episodes of dizziness or fainting or can't get out of bed, that needs to be evaluated. For kids with chronic pain, these type of symptoms are quite common and oftentimes aren't there at the beginning, but then develop or worsen. And so, you may have a child who already has chronic pain who's got some of these symptoms. Well, I think you need to let your child's doctor know it's unlikely to be something else. So it's likely it's likely an autonomic disorder, autonomic instability. And the treatment, again, is going to be slow, gradual movement. So if your child is having trouble getting out of bed, then the next step would be sitting up in bed. Next step would be getting to a chair. That's why I like, for exercise, I like things like recumbent bikes because they're not as challenging or from an orthostatic standpoint. I also like swimming because swimming, you're horizontal, you're buoyant, you're not as challenged from a orthostatic standpoint. So again, it's, moving from, it's gradually moving and increasing your ability to do things. And, and getting to work with a professional who can help you determine what's safe and what's not. That's the great thing, again, getting back to physical therapy about what else is safe and what's not.
Well, I really like the swimming and the recumbent bike. I wish I had known about that because I think it's, it really gets to be such a psychological problem for these children who then have fear, right? And then they've triggered their anxiety. And so having a list of things that I never thought about, right? Swimming, you're horizontal. So for the kids that are so exhausted and they're just fatigued. So I think we should assume for everybody, we just covered that if your children presenting with any of these symptoms, they need a proper workup and that they can introduce the concept of POTS to their doctor, because I know I saw many, many doctors and it was not introduced to us. And it was definitely.
Yeah, I think it's not uncommon for me to be the first person to, evaluate a kid for orthostatic intolerance, despite the fact that they've seen multiple physicians. So that's not an uncommon phenomenon.
So the important part is that everybody makes sure that they are seen and have a proper workup. That being said, once they've had that workup and nothing's been found, these are things that we could be using along the way that seem less stressful in the body, but can also increase it can help our children know that they're going to survive if they do a little workout. Because I know that they're panicked that if they stand up and walk across the room, they won't make it, they're going to pass out. It's the psychological piece and the physiological pieces coming together, it sounds like, to help get the kids through POTS.
Mhm.
And I think I'd love to interject here, if you wouldn't mind talking about really the fact that this doesn't have to be a lifelong set of symptoms they live with.
No, it really doesn't. I mean, I have a number of kids who have no POTS symptoms anymore. And in fact, many kids do really well. They go through a period where it's challenging and they struggle. And then through treatment, both exercise, cognitive behavioral therapy, medications, I see a number of kids who do much better, who are fully functional again, and that the timeline of that is variable. It's certainly, we're not usually talking weeks, we're usually talking months, and sometimes a couple years to get back to where they want to be. But I've had, I know many kids, I see them all the time, who are now got their, what I say, get their life back and are fully functional. If you look at the literature, they'll talk about adolescents with POTS, 2 to 5 years is kind of that window, and that, but it's hard to know for any individual patient. But I do think the prognosis of POTS for the most part is quite good. So I worry, and I noticed Dr. Walco put a note in the chat. I do worry about patients who feel like because they have POTS, or because frankly they have a chronic pain disorder, that their life are going to be one of disability, because I really don't believe that. I don't, I really believe with ongoing care and effort, and it's not easy, I'm not saying it's easy, that you can overcome many of these symptoms. Will some kids have ongoing symptoms into adulthood? Yes. We'd be silly to say that that wasn't the case. But the majority of my patients who stick with these programs are extremely functional, and it can be extremely successful. So it's not getting bogged down into what's on the internet. And, I often say that family, the people who are spending a lot of time talking on the internet, the patients who are doing well don't spend a lot of time. So, so you get a very biased sample looking at those patients or those families who are spending a lot. And not that the internet doesn't have good information, but it can be really, it can suck you in. And so I encourage families to realize there is light at the end of the tunnel, but it's not, there is no immediate quick fix. It takes time.
It's like training for a marathon, right? You're not going to go run the miles. You have to just put in the time, and it eventually makes you a marathon runner. But and when you first started, you didn't think you'd be able to run 5 miles. Now you're running 25.
Yeah.
It's the same thing. And I've also seen so many kids who were bedridden, afraid to go to the bathroom, now that got up and played on a football team.
Yeah.
And interesting enough, a lot of these kids, when they finally realize that this is a set of symptoms and that there's things they can do to not allow their autonomic nervous system get so stuck in fight or flight. And that awareness helps people adjust. And, just the word saying, I am calm, I am safe, signaling the brain to send the chemicals to say, really, I am okay. You don't have to send all the other chemicals through the body to help us stay ready and prepared for war every day. And I really wanted to make that point at this point, because we're talking about such important things, and they're so scary when you first see your child present with any of these. But
yeah, and some of it, there's a real sense of anxiety when you feel dizzy and your heart's racing, and maybe even the room's getting a little black or whatever. There's a real sense of anxiety there. Once you understand what that is, that helps. And you just say, oh, that's just my POTS. It's no big deal. Let me sit down for a second, and then I'll get up slowly, and then I'll keep going. So, because once you understand that, it makes it easier, instead of that's my POTS, or I don't know what that is, now I need to lay down and I'm done for the day. No, you take a step back and then you start moving forward again.
I really like that, because that's just a roadmap for people to use where they get self-empowered. I love a good toolbox. And I love that the kids can say, yes, this happened, but it doesn't have to have the entire bottom fall out for them.
Right.
And they can just calm down for a minute. It doesn't have to be. And once knowing that it's just a dysregulated system, once you've had a workup, that you can do these different things, that it doesn't have to mean that the next 5 things are going to happen with it.
Right.
What, I saw Dr. Zeltzer was mentioning brain fog.
Yeah. So, I mean, brain fog is a complex phenomenon that we don't totally understand. I will say in POTS, if you don't get, what's going on in POTS is your blood, because of the lack of autonomic tone, you don't get blood back to your heart, and then you don't get blood to your head or sometimes to your other organs. So lack of blood to your head, dizziness, brain fog, fogginess, fatigue is also a major symptom of POTS. It's also obviously a major symptom of other chronic pain syndromes. And I don't want to say we totally understand why that is. And there's likely overlap in causes but certainly it's fatigue is a major symptom for kids with POTS, as is brain fog, as sometimes is headache as well. So even for kids who have chronic headache who may not have some of these other symptoms, I really think an important, getting your physician to think about POTS is another important piece, right? So, but fatigue and brain fog, are really challenging symptoms, and can be worsened by some medications as well. So you always want to look at, okay, what medications you're on. I don't want to, I want to save medication a little bit. So we'll talk about what I think are really helpful medications for brain fog and fatigue based on my own experience in the field. But I think there are some treatments that are appropriate, and also, how to get appropriate accommodations in school are really important. And that might include, you have brain fog, fatigue. Again, it's extra time for class to class, a lot of rest in the nurse's office. It might be extra time for testing, reduced homework, but emphasizing that we still need to get your child to school, all right? That POTS and chronic pain, in my opinion, are not reasons not to go to school. Without the appropriate modifications are important, and we can help support kids. But being in school is, again, it's about movement, it's about social interaction, it's about getting educated. These are all, in my mind, school is it's an important treatment. It's also an important outcome. It's one of the ways that I really measure how successful are we being with our treatment. Is your child able to get to school, and how can we help that happen?
Absolutely. And I wanted to go back for a minute and talk about the physical temperature dysregulation,
Sure.
because that's something that doesn't always get discussed.
Mm-hmm.
And I'd love to give it a few minutes to just talk about how that happens and what we can do about it.
Well, your autonomic nervous system regulates your temperature and your body temperature, but also your temperature experience, because if part of your body's response to change in temperature is either vasodilate, have more blood at the surface of your skin, or vasoconstrict, have less, right? And if that's out of whack, your response to your environment is going to be out of whack, right? So, but also your own internal temperature setting may be out of whack. So, other than the treatment of the primary condition, there's not a lot of great treatments that I'm personally aware of specifically focused on temperature and stability. So unfortunately, it's always have a sweater and have a t-shirt under it, because, I don't want to give the example of the woman in menopause, but I think that's a salient example. I can't personally speak to that, but, sweater on, sweater off, etc. Is going to be important, because sometimes these kids will be in a warm room and they'll be shivering. Sometimes they'll be in a cold room and they'll be sweating. And so it's really trying to help yourself modify that temperature. It's important for kids with POTS not to be in extremely warm temperatures, because that also leads to fluid loss, vasodilation, more dizziness, more symptoms. So I tell families, avoid prolonged time in hot temperatures, don't use hot tubs, short showers, or sit when you're in the shower. I've mentioned swimming, which I think is a great exercise, but certainly some of the therapeutic pools can be quite warm. that may not be the best place to do your exercise. So it's making sure you're not in the extremes of environment and avoiding some of those triggers, especially from hot environments as well.
I really think knowing that this information will be calming, because I know as a parent, if I had known that, I go, oh, it's okay that we're going from hot or cold. This is a symptom that your body is dysregulated and needs some help regulating. And you can use your clothing. The heat, I can personally say, I've seen how that really is it can not be the best thing for somebody whose system is not regulated.
Yeah.
So I think that this is all very helpful. And I wouldn't have thought about the heat, but that's an important one too. And I just think knowing, this information is so important to help calm us as mothers, but calm us as patients. So thank you for really describing all of this in depth.
Sure.
I think, the exhaustion is probably the number one thing that we see with patients, and they're just mentally saying, I'm fearful.
Yep.
If I get up, I'm going to do this.
There's certainly, in many chronic pain disorders and in POTS, we see a lot of anxiety, right? And I never think it's anxiety is causative, but their anxiety, certainly coexists in a lot of our patients. And that anxiety, stress and pain or stress and POTS, it's like it's like a ball tumbling down a hill, it just keeps each other going. And if you're anxious, your heart rate goes up, you might hyperventilate, you're going to feel dizzier, you're going to have more symptoms. So it's controlling anxiety as a coexisting symptom can be really helpful for POTS patients or pain patients as well. So that becomes really important and gets back to what I said about just recognizing what these episodes are. And that can diffuse some of the anxiety, and then learning, okay, this is what I can do, this is what I can't do, right? And then gradually moving from and so that can gets bigger and that can't get smaller.
What can we do for kids in school and climates that are just not helpful for somebody with POTS? They're just innately hot. Is something that we can put in accommodation that can be asked for the children to not be outside on those particular?
Yeah, there's certainly other medical conditions where kids should not be in the heat. So this should be something that, if you put in a 504 plan, which, is requesting accommodations for a child with a medical illness, it's a legally required mandate for schools to accommodate kids who have medical illness. So, asking to avoid extended time on the playground if it's hot outside. Many schools are air conditioned, but some not, or some only have air conditioning in some rooms, requesting that your child only be exposed, in a room that's air conditioned. I know this puts schools at some challenge, but that's not, parents' problem or frankly our problem. That's for, we can help the school problem solve, but they've got to solve the problem and say, how do we accommodate your child to make sure they're not exposed to an environment which is not safe for them? So that becomes, unfortunately, that requires a fair amount of advocacy sometimes, but is a necessary step. Elevator passes, sometimes become important. Although over time, I don't want the child to always be in the elevator. I want them, okay, once you can walk the stairs, you're going to walk the stairs, because we're going to encourage normative behavior, and we're going to encourage you to not need. We're going to work so you don't need an elevator.
With the schools, I think the 504 is probably the most effective way, because if the school is pushing back, then and schools often say, oh, well, you don't need a 504. I would rather the parent have a 504 or the child have a 504 and not use it, than not have a 504 and always be trying to get the services and accommodations that they need. So I think it never hurts to ask for a 504. And with regards, I would love to circle back at this point and talk about what medicines you see, because anxiety, I think almost everybody would say anxiety becomes part of this mix, whether it started it or it's an effect after. It's really the comorbidity. It really is the big elephant in the room. And how I'd like to talk about the medicines you've seen that have actually been effective in helping, and also some of the other things that are non-medical, non-medicine
Sure.
related.
I'm going to start with the non-medical first, and then
Great.
we'll work our way through, because that's how, So I start with every patient talking about, things they can do at home to change things. So again, that means avoiding hot tubs, short showers, not excessively long periods of standing, avoiding the heat. For some kids, compression stockings can be helpful, and they're quite fashionable now. So, getting some good compression stockings can be helpful. Again, we're trying to push blood to the center of the body. So getting compression stockings is something that is acceptable to wear at school, is a good way to help do that. One of the other things that I do is I tell patients that they raise the head of the bed. And that doesn't mean just being on pillows, but putting the bed at, about a 20 to 30 degree angle, which means putting bricks, if you can do it, bricks or something else, books, under the legs at the head of the bed, so the child sleeps a little bit of an angle. What that does is it doesn't allow the vasculature to totally relax at night, so that it's continuing to work to pump. So what we tend to see is orthostatic symptoms are worse in the morning. So if we just have the bed in an angle at nighttime, Lori says there's a wedge on Amazon.
That's what I was just writing.
So great. So those are kind of the physical things that I recommend, and there's likely a host of others. Getting up slowly, et cetera, et cetera. When you are taking medicine, take them even before you get out of bed. And stay there another 20 minutes. That can be helpful too, to ameliorate some of those early morning symptoms. So those are some of the things I recommend physically, along with a graded exercise program. When I first see patients, I talk about two things: water and salt. And so water, most people will say a minimum of 8 8-ounce glasses of water a day. You could probably double that, and that would be fine. So I want these kids drinking all the time. That's where accommodations allow for a water bottle in class, because some schools, and always being able to drink, but also having access to the bathroom if you drinking, the water fluid goes through you. And then salt, a lot of patients will go to a physician and they'll say, oh, well, increase salt in your diet. And what you find out is that's really hard to do, because I want kids to get 2 to 3 grams of salt a day. And what I tell my patients is that's 20 bags of potato chips. You don't want to eat 20 bags of potato chips. But I use salt tablets. And actually a patient told me about it. I don't own stock in this company. So, but the ones that I mostly recommend now are called Vitassium, Vitassium. They're available on Amazon and some other sites. They seem to be really well tolerated by patients, and actually they expressly say that they're for patients with autonomic disorders in their packaging. So I like those. My patients seem to tolerate them well, and I have patients using 2 tablets with every meal 3 times a day. So so some patients you just start with salt and water, and I've had a lot of patients who do much better without any. I'm going to put the name in the chat right now for everybody. And if I get a second, I'll even find the website. But it's Vitassium, and if you look that up, you should be able to find it. And then, so that's where I start. Oh, thank you. Yeah, Salt Stick. And they actually, I'll give out, the company sends us free samples. So I give out some samples so patients can try them and make sure they agree with them. Some patients complain of stomach upset with salt tablets. I've had a much better experience with these, which is one of the reasons I like them.
Dr. Zempsky, what's the difference between a salt tablet and these fluid replenishers? Pedialyte being the most common brand name. But
yeah, I think Pedialyte is fine. I mean, they have a lot of salt in them as well. If they're not low calorie, then they tend to have a lot of calories and sugar. And it's just, again, I'd rather I like to separate the salt and the water. It just makes life easier, in my opinion. Some patients find it helpful. I think that's fine, but I tend to stick to this regimen. It's probably less expensive over time than buying all the energy drinks and the Gatorades and things like that, frankly. So, water and these salt tablets works pretty well.
And compared to an IV, I know we're in Southern California, so we run for IVs any chance we get. But
yeah, I'm not a big fan of, we can talk about that, but, I don't think for the vast majority of patients, IV replenishment on a regular basis is necessary. There, if you get sick, if you get dehydrated, you've had a viral infection, different story, because I do think kids with POTS take longer to recover from viral infections, et cetera. But I really worry about frequent IV therapy, especially for kids who are going and getting things like central lines or ports placed. It exposes them to a lot of other risk that I think is unnecessary to treat this disorder in the vast majority of patients. So I try to stay away from that if at all possible. So medication. So clearly, if there's, I'm not going to get into anxiety and sleep disorder, particularly, except to say that, as we talked about, these are both comorbid conditions with both chronic pain and POTS. Appropriate treatment of anxiety and sleep disorder can be really helpful for these syndromes because those medicines tend to work pretty well. And, so if that's a part of the syndrome or is causing challenges, and I think those need to be treated as well. Once I get beyond salt and water, I have a few go-to medications. People talk when they're treating POTS about 3 major medications, and I'm going to add a 4th. So they talk about there's a medicine, flucortisone or Florinef. That is a steroid medicine. What it does for kids is it pulls salt and water pulls salt and then water follows into the blood vessels. More salt in the blood vessels, more water in the blood vessels, more volume, more blood to your head. So that's how. So Florinef is not a bodybuilding steroid. It's what's called a mineralocorticoid, but it helps salt retention. And it helps pump blood, helps keep blood in the vessels and more blood to your heart, more blood to your head. So, and it does work. So Florinef, I like Florinef because it's once a day traditionally. So it's pretty easy to use. Most patients do pretty well with it. Some patients will retain water. Some patients will get a little moody. But and if you get on a higher dose, sometimes you can lose potassium. So you need to have your blood checked every now and again to make sure you're not losing potassium. I don't, originally, if I'm on a lower dose, I don't do that. So Florinef is one of the 3 major medicines people talk about for POTS. The second one is a medicine called Midodrine, Midodrine. People will know less about it. It's one people don't tend to use as much, but Midodrine is a nice drug for POTS because it's a vasoconstrictor. So it constricts the blood vessels, especially at the periphery, at the outside of the body, and pushes blood into the vital organs, into the center of the body, more blood to the center of the body, more blood to your heart, more blood to your head, less dizziness, less symptoms of POTS. Midodrine is nice because it's got for a couple of reasons, it's got a very low incidence of side effect. The most common side effect is goosebumps. And the goosebumps are just because you're constricting your blood vessels. So your body, it's kind of like when you're going out in the cold, you get goosebumps. It's because your blood vessels constrict. It's the same thing with Midodrine. In older adults, it can be associated with some high blood pressure laying down. We don't tend to see that in kids. The plus and minus of Midodrine is it has to be given usually more than once a day. And usually it only lasts in the body 3 or 4 hours. So what I have patients do is take it first thing in the morning, like even before they get out of bed, then 4 hours after that, than 4 hours after that. So they're done with that medicine by about 3 in the afternoon or earlier. And the nice thing is orthostatic symptoms tend to get better as the day goes on. So you're trying to front load that medicine earlier in the day, and it's less needed later on. And patients who will stick with the regimen find Midodrine fairly helpful. And then the third common medication that is used is beta blockers. And and it's not entirely, I don't want to get into the different causes or quote types of POTS because I'm no expert in that. But some people think there's disruptions in your norepinephrine and epinephrine system, and the beta blockers may work by that mechanism. They may also decrease your heart rate response to kind of changes in position. So, but beta blockers are also, and usually are once a day. The ones I use are either atenolol or propranolol usually. There's others that are out there that different people use. But those are the three staples of POTS treatment. I will tell you, as I've done this more, I have tended to use stimulants more and more for POTS and associated symptoms. Because a lot of the kids that I see, and it gets back to what Lottie mentioned before, they don't just have POTS symptoms, they have brain fog, they have fatigue, they're exhausted at the end of the day. And those are, and so it's never clear how much is POTS versus their chronic pain syndrome. Long COVID is another area where we've started to use stimulants. And I found them really quite helpful. So that the same medicines that people use for ADHD, the primary one I tend to use the long-acting ones because that way you take it in the morning, it's available, it stays in the body till sometime at the end of the school day. And then if you need to, you can take another short-acting dose in the evening, but a lot of my patients don't need that. And I use a medicine called Concerto, which is a long-acting Ritalin. I also use a medicine called Adderall. Usually I use Concerto just because it's the one that I kind of got comfortable with first. And the nice thing about these medicines, again, low incidence side effects. Sometimes kids feel their heart racing. Some kids will get too jittery. Some kids, it impacts their mood. But really a relatively low incidence side effects. The other thing is, you know right away whether it works. Like you feel, it's like taking 3 cups of coffee in the morning. You feel it and so you don't have to try a medicine for 3 months and decide whether it's going to work for you. You might start at a dose and decide that's too low and go to a higher dose. But the stimulants tend to work pretty quickly for these symptoms, whether it's POTS or some of these associated symptoms. So I've had a lot of patients who I treat with, if I'm not sure which is the biggest contributor, and I don't think it's all POTS, but it's some of these other things too, I often will start with a stimulant and have had good success with that. So those are kind of the medicines that I use. There are some other medicines people use. I've had a couple patients who failed all these others and been on things like pyridostigmine. And I will often use, of those 3 original medicines, I will often use for kids who, and I've had a few of these who show up, who actually get admitted to the hospital as their first kind of event. Like they've been fine, they get some type of viral infection and they can't get out of bed, they get admitted to the hospital. And those kids tend to start out are quite severe. And I'll often have them on 2 or 3 medications targeting their POTS at once. And not a lot of these kids, but because they all work by different mechanisms, sometimes I'll have them on 2 or 3 medicines at once, along with salt and water, et cetera. And I've had good success treating those kids with those kind of regimens. But that's kind of, it's fairly straightforward. Most of the medicines are pretty safe. And not every kid, I am not an expert in autonomic testing, and there are not many people who are. But there are autonomic testing. Some people can help you, or other tests that could help maybe pinpoint the cause of the POTS and the appropriate treatment, that's not what we tend to do at our center. We treat very clinically. We're very clinically focused, partly because we don't have access to that testing. It's hard to access in most towns and cities unless you're in a really specialized place. So I don't necessarily advocate for it unless I have some patients who really are not getting better on any of the typical treatments.
And at that point, once they do a tilt test or some of the other tests, what changes the medicine approach?
Well, it's a good question. I think sometimes they can more pinpoint what the etiology is, and I alluded to some of the abnormalities in the norepinephrine system, et cetera. There's some, again, I'm not an expert. And the tilt test alone is more of a tilt test is a very non-specific test. It'll tell you if you have POTS or not, but or other orthostatic disorders. It's not going to tell you the underlying cause. There are some more sophisticated tests that might do that. Some people talk about other neurologic disorders that might be at the core of POTS symptoms, some neuropathies, et cetera. So those tests can be done. I would tell you for the vast majority of patients, it's not necessary. For the vast majority of patients that I see, it can be quite successful without resorting to additional testing, and usually get better with the kinds of therapies. Again, and I want to emphasize getting back to the physical stuff, physical therapy. I saw somebody asked about the modified CHYP protocol. CHYP, I believe, modified their protocol. There's a Dallas protocol that was developed. And then CHYP developed a modification of this. And this is more, it's a daily, very structured, I haven't studied it at length, but it's a very structured program of gradually increasing exercise and movement. So I think it's a very reasonable thing to try, because that's what we're trying to do. We're trying to gradually increase somebody's capability of doing exercise and movement. So I would certainly be supportive of a family who wants to do something like that. If it's not under the auspices of a physical therapist, then you need to be pretty self-directed. Not every 13 or 14-year-old is particularly self-directed. I like having a physical therapist or trainer involved, because it takes the parents sometimes out of the middle of this, because there's a lot of conflict that can arise from trying to get your child to do things, any adolescent to try to do things they don't want to do, especially one who's got an illness as well.
I mean, this has been such important information, Dr. Zempsky. I can't thank you enough. I think just not enough conversation about POTS and just how to look at it and what we can do at home. I think for parents at home to hear, there's some things you can do, and you don't have to react as well to being so nervous that you're seeing your child hot, cold, that this is part of it. Mm-hmm. And I can't thank you enough for your time and getting the information out to as many people and allowing us to put this out there, because I know when my child was dysregulated, this was really invaluable information that I would have been looking for. So we're trying to get that out to as many people as we can.
I do want to mention a couple things, and we do have a couple more minutes if anybody has questions. Ani asked me a question about stimulants and weight loss. Stimulants can reduce your appetite. For the most part, Lonnie, I think, and it was just actually about a week ago, I've only had one patient who I've had to stop stimulants because of weight loss. We always worry about our chronic pain patients, especially ones with abdominal pain, developing some eating disorder-like behavior too. So I do monitor and pay attention to weight in my patients on stimulants. Usually it's not an issue, because if they're feeling better, they eat better, in my experience. So I haven't had a lot of them lose significant amounts of weight. But I do think those kids need to be closely monitored and watched. And if you start seeing weight loss, unfortunately, that might mean removing that stimulant. So I guess that's what I would add about that.
And I have one more question for you, actually.
Sure.
Before we kick it back to Lonnie. how does massage come into this? Because I know there's a lot of modalities that are being used. I've had it be very helpful in my own family, resetting the system with a certain type of massage.
Yeah.
But if you could talk about pros and cons to normal massage versus some
Sure.
specialized massages that we use at CHYP.
So manual therapy, I'm a big fan of manual therapies in general. If you talk to the folks who do osteopathic therapies, I've had some patients who really feel that's been helpful because the osteopaths really feel like they can reach the autonomic nervous system. And so I think that, and if there are, and many massage therapists use some osteopathic techniques. There also is a feeling in some camps that muscle tension, and another term, adverse neural tension, which is not a term that everybody's familiar with, but the theory of putting your tight muscles putting tension on your nerves can lead to POTS symptoms. So to the extent where there's a lot of muscle tension, especially in the neck and chest, it may be that manual therapies could be quite helpful, and massage would be one that would reduce muscular tension. So I think, looking at some of those osteopathic therapies or other manual therapies, osteopathy is really interesting. I don't pretend to totally understand it, and what I tell families in general about therapies such as osteopathy or any, because there's a lot of, I'm a firm believer in osteopathy. There are a lot of therapies out there that I know even less about. So therapies should be safe. They should have a reasonable course of treatment, meaning, not one, but not 1,000 to get, before you expect to see benefits, and they shouldn't break your bank. So nobody should say, oh, you need to pay me 10 grand up front for this course of therapy. So I think those are, really important for our patients who may be looking at a lot of different therapies. But I think I'm a firm believer in some of the manual therapies for a lot of our pain patients. I think they can be really, really valuable. And certainly for the most part, they're quite safe. And, and obviously some of them insurance doesn't pay for, and you have to pay out of pocket, but hopefully those are reasonable charges and not unreasonable.
Just remember to get up slowly after your massage and your treatment.
Yes, well, and I was going to mention that. Thank you.
Well, thank you again. Lonnie, would you like to close us out? Again, I just can't thank everybody enough, and especially for everybody's time coming today.
Yeah, sure. Meg was going to do this, but
yeah, I can do it. No worries. Hi, everyone. Just wanted to say thank you so much to Dr. Zempsky and Dana for that extremely informative and, as Lori said, also hopeful presentation. I think you did a great job of providing some useful and directly applicable things that can be integrated into the lives of these children and patients and young adults with POTS. So thank you so much. And thank you all for joining us today and sharing your questions. If you have any other questions, please feel free to email me at meg@mychip.org. And this concludes our October webinar. We'll be uploading it to our CHYP website on our YouTube channel, so you can find it there. And then we will also be sending out information for our November webinar in the next week. So thank you so much again to our presenters and for all of you for attending today.
And I just want to do a last huge thank you to Bill for Dr. Zempsky for taking time in your super busy schedule. Follow Dr. Zempsky's research, and he's an outstanding clinician and educator, well-known and well-loved in the international pediatric pain.
Thank you, Lonnie. I really appreciate it. It was fun. I loved doing these.
Thank you, Dana.
It's really, I hope it was helpful.
It was
Have a great day, everyone.
It's great. Thank you, everybody.